Hey guys, Dr. Salaf, and I just came back from a party, but I thought it was super important for me to tell you about a conversation that I had with two separate dermatologists, but it was about the same thing, and it was about prescribing local vaginal estrogen. Now, both of these providers were unsure whether or not it was safe and were worried about causing blood clots in patients if they gave them vaginal estrogen. Now, as we know, vaginal estrogen is not systemic, meaning it doesn't go throughout the whole body. It stays where you place it, and it is local, so it helps the tissue in that area, right? So when we give local vaginal estrogen, we are treating something called genitourinary syndrome of menopause, and a new term that was coined genitourinary syndrome of lactation. And that's basically when we have low hormone levels of estrogen in our body. And it's super important because in order to help treat it, we need to give back the estrogen, and we do that by prescribing the vaginal estrogen. That vaginal estrogen is going to prevent recurrent UTIs, it's going to increase lubrication, it's going to decrease the irritation, and it's going to decrease that overactive bladder that patients complain about. So make sure that if you are a prescribing provider, that if your patient comes in and she's in perimenopause, menopause, even postpartum, that you go ahead and ask her how she's doing and how her sex life is, because she may need some local vaginal estrogen, and you could make a huge difference in her quality of life. So make sure you're asking those questions that are super important and prescribe that vaginal estrogen.